Hantavirus. Before we begin, follow Money or Politics and watch this video entirely. What happened to the Hantavirus at sea? The recent Hantavirus at sea incident involved the Dutch cruise ship MV Handius, where several passengers and crew became ill during a voyage that started near Argentina and later moved across the Atlantic Ocean. Health officials believe the outbreak involved the rare Andes strain of Hantavirus. What happened to the Hantavirus at sea? The latest Hantavirus at sea incident took place on the Dutch cruise ship MV Handius, wherein several individuals on board suffered from illnesses that were attributed to hantavirus. According to health authorities, the hantavirus outbreak might be caused by a rare variant called the Andes strain of hantavirus. What happened? Several individuals on board the vessel developed symptoms related to hantavirus infection. There are at least 3 deaths and several individuals hospitalized and quarantined. The cruise ship was briefly prohibited from docking amid an investigation into the hantavirus outbreak around Cape Verde. Ultimately, passengers and crew members were evacuated and quarantined in various countries, such as Spain, France, and the United States. How did it likely begin? It is believed that the first case on board was infected outside the ship, presumably during birdwatching and traveling around South America, where the Andes strain is naturally present among rodents. Why was this outbreak noteworthy? For most types of hantaviruses, transmission is restricted to between rodents and human beings. For the Andes strain, however, transmission is possible even between humans after close interaction. This was particularly problematic due to the crowded environment on cruise ships. Is this another COVID-19 type pandemic? The World Health Organization, WHO, and other health authorities have continuously stated that this is not another type of pandemic like COVID-19. Transmission is much harder and involves prolonged close contact. What happened after? All passengers and crew were isolated in quarantine for up to 42 days. Authorities started contact tracing individuals who sat nearby the infected patients on the flights. The virus is being sequenced to see if there has been any mutation. If someone may have hantavirus, they should get medical care immediately, especially if they develop breathing problems after possible exposure to rodents or mouse droppings. Symptoms usually begin 1 to 8 weeks after exposure and may include fever, chills, severe fatigue, muscle aches, headache, nausea, or vomiting. Later symptoms can become dangerous very quickly when there are coughing, shortness of breath, tightness in the chest, and/or fluid buildup in the lungs. You should seek emergency medical attention. Tell doctors if you are exposed to mice, rat droppings, cabins, sheds, barns, attics, or dusty enclosed areas. Do not ignore breathing problems because severe hantavirus can progress rapidly and may require oxygen or ICU care. Rest and stay hydrated. There is no specific cure or antiviral treatment proven to eliminate hantavirus, so supportive hospital care is critical. Avoid exposing others in any case. Most hantavirus strains do not spread person to person, but the Andes strain can in rare cases. Follow public health guidance if doctors suspect that strain. When you are in the hospital, you will get oxygen therapy, IV fluids, blood pressure, and oxygen levels monitoring, and/or mechanical ventilation. Do not sweep or vacuum rodent droppings around the home after exposure. Do not wait several days if breathing worsens. Do not assume it is just the flu if you recently cleaned a rodent-infested area. At home, seal holes where mice can enter, store food in sealed containers, use disinfectant spray on droppings before cleanup, wear gloves and an N95-style mask when cleaning contaminated areas, and air out enclosed spaces before entering. This concludes hantavirus. For more topics, follow or subscribe to Money or Politics.